Dr. Malika is our next speaker. He graduated from the University of Medicine and Dentistry in New Jersey in 1983. Prior to dental school, he received his master's degree in human anatomy at Fairleigh Dickinson University. He's an author, a researcher, a speaker, and currently on the board of IAMT Board of Directors and the chair of the IAOMT Biological Periodontal Committee.
Thank you very much. I'll need this. Thank you and good night, ladies and gentlemen. Okay, so to keep you all wide awake today, I put a whole bunch of kind of freaky deaky pictures on the slides today to keep you wide awake, and how we're going to handle that today. It's going to be a lot of fun. So I'm going to talk about kind of like model in which to work that we can deal with multiple deep infections that we're seeing more and more today. And also we're going to touch on the concept of osteonecrosis and how we can reverse that biologically without getting there too surgically with that, which always kind of puts my hair on end when we're digging around those jaws. So the first thing is that, I want to have a little education of facts, but more importantly, kind of think about the things I'm talking today and how you might consider integrating that into your practice every day. And the basis for that is ozone. Now, does ozone, play a role in something like this complex infective disease states? This is squamous cell carcinoma. Even though we don't treat cancer, we never treat cancer, of course, unless you're an oncologist, there's associated infection with that. Can we approach that and make this a little bit better? Does ozone play a role in osteonecrosis, osteonecrotic lesions? Can we reverse those non-surgically and prevent the surgical interventions that are somewhat popular today? So, but in the integrative model that we work with, a number of IMT people have been trained in that model, is that unique patients really require a unique model to work within. Okay, and we call it integrative biologic dental medicine. So, of course, this is one of our better cases that we've done. But beyond that, the philosophy behind what we do is really, we're partnering with the patient, okay? We're developing a team that can integrate, biologic, safe, effective, established modalities. And this comes back from the concept of integrative medicine. So these treatments are safe and effective, and what we're supporting is the patient's own innate healing processes. So our goals are patient outcomes, and our goals associated with this are really, first of all, biologically thinking, biologically functioning, homeostatic re-regulation and normalization of what's called dysregulated tissue. Tissue that may be infected, something is affecting the tissue that is not functioning correctly within the human system itself. We want proper metabolic function, meaning it's two phases of metabolism: oxygen-based metabolism and a fermentation process where we start burning sugars. It's a very dirty type of concept where we're going from oxygen-based, we're producing a lot of ATP, a lot of great energy, 36 ATP, we're feeling fine, and something goes on, that slippery slope that we start to slip into a fermentative state where we're burning sugars, and we see this in these more chronic diseases today where we're getting about maybe 2 ATP. We see that chronic fatigue type of patient, okay? And of course, a functional detoxification of the extracellular matrix, which is the interface between the vascular system, lymphatics, and the cells themselves. We want the circulation, immune system enhancement, functioning right, good blood flow in, good blood flow out, proper immune function, meaning the immune system is functioning in an intelligent way. Not a hyper way or a dumb way where we don't know what to do. We want a balanced function there. We once again want to restore normal oxygen metabolism. We want to stimulate our antioxidant system in a balanced way. Get rid of pathogens. One of the most important points when we talk about pathogenic load, remember, I spoke about this yesterday. We are colonized. Remember, we are colonized. Our mammalian cells are 10% of what and who we are. 90% is bacterial or some other forms on us. So for years, and I talked about this yesterday, for years we've been pounding on 90% of us. And we're paying the price today for that with this antibiotic therapy, the cumulative effect of antibiotics changing our microflora, which is 90% of us. And that's hard to perceive, Because we've always nurtured, we love our mammalian cells, we do. But the reality is we have a symbiotic relationship with this normal microflora. So if you nurture that, things can change, okay? And of course, any pain elimination. Once you start balancing all these type of systems, okay, the pain elimination, restoration, and function occurs. But most important, this is one of the things we drive so hard with our school, is healing. How do we support the patient's own innate healing processes? Once you start thinking about that, how we can support their innate healing process, you start to think differently, okay? In the allopathic model, the model we come out of dental school with, we're doing all these wonderful things, we're just overwhelming the patient with stuff. But reality, we start thinking differently, understanding the healing processes and supporting that process and guiding. Because the only way a patient can heal, they must heal themselves. So we develop a model around that. We have what's called a therapeutic architecture, a therapeutic design, and that philosophy we just talked about, supporting that patient's own innate healing processes. So we're thinking really biologically, okay, in a biologic manner. When we look at a patient in this model, we're really looking for the biologic underpinnings. What's going on biologically? This is when we get back to our basic sciences. What the hell is going on with this patient that's creating what we manifest itself as symptomology? So when we do the therapeutic design, we're looking for things that are not suppressive therapies. Not suppressive because we don't want to drive things in. We don't want to drive it into the system and put Band-Aids on. Because listen, that's what antibiotics, all these different things. Let's put Band-Aids on the situation. How can we fix the patient? How do we fix it? And support that, what's called that re-regulation, so the body is regulating normally and it can heal itself. And normalization of that dysregulated tissue, which I'll show you. And once again, allowing that patient, in physiologic terms, to return to what's called homeostasis or balance. Okay? When we get into the architectural concepts, we want to talk about the principles of synergy. When we develop our protocols and the things that we put together for the patient therapeutically, we want to be synergistic, okay? We don't want antagonistic type of therapeutics because that brings the patient back and forth, back and forth. We want to support them in a synergistic way, and I'll show you a little sample of that. And the principle of anti-homotoxicology. The toxins how do we get rid of the toxins that we build up? We're really unfortunate, like a little garbage can. We're dealing with what? Biggest things today is what? Environmental issues. We're dealing with mercury, fluoride, just breathing the air. And that stuff tends to accumulate in us. How do we safely and carefully get the parts of drainage out of our system? And when we talk about drainage in the human body, what are we talking about? Or any biologic system? Draining. How do we get rid of toxins? Well, you got to poop it out. One of our mantras, you got to poop good to look good. Right, Bill? And he's looking good today, isn't he? I told you I'd pick on you a little bit. Griff is always looking good, so you know what he's doing. Well, you got to poop it out, you got to pee it out, you got to sweat it out, and you breathe it out. So one of the most important things, even when dealing with detoxification of patients with mercury, all these different issues, you got to make sure those pathways are opening and functioning. When you have a patient that's constantly constipated and diarrhea, this and that, you've got some gut issues and they can't eliminate things correctly. So those fundamental parts of drainage are very important. And the fundamental principles of ecology and biology. Remember, you're a fundamental ecosystem. Okay? You're a little beautiful lake. If you're nice and healthy and happy, the fish are happy, the water's beautiful, clear, everything's going fine. But if you become that little polluted lake where the oxygen starts to drop off, things are not being cleaned up properly, that's when that ecology in you starts to shift and you go down that slippery slope into that chronic disease state, which you do not want to go. And of course, the principle supporting regeneration. Regeneration of the cells, regeneration of the tissue, and of course, regeneration of yourself. So the principle of synergy here, and it's an example that I have here. We're using ozone and all the other homeopathic remedies that we do use. We talk basically on two principles here. The principle of hormesis, and that's one of the most important cornerstones to ozone therapy, where less is more. When we used to start ozone years ago, we used to, these great high micrograms. Oh, we used to just pound the hell out of ourselves. But that really slowed the process down. What ozone does today is, in an elegant way, stimulate all those basic biologic principles that we have, the physiologic pathways we have, and move those along in a positive way. So hormesis is a favorable biological response where less is more. But there's tricks you can do if you synergistically bring us together. You can amplify that process based on the Berge principle. We have two different substances or similar, have had up similar effects that can enhance that out. So these are two fundamental, basically what's called bioregulatory principles that you can apply to everyday practice itself. For example, we use procaine and ozone. We synergistically we call it Prolozone. A friend of mine, Frank Schallenberg, developed the concept of procaine and ozone become combined together in a synergistic fashion. Well, why is that? Moving things along in the same way. Well, we're going to repeat this, but once again, we've had the scientific facts associated with ozone therapy. It has disinfection properties, wound healing, improved wound healing. It activates red blood cell metabolism that allows for easy exchange of oxygen and carbon dioxide. It produces nitric oxide, which we love because we want to open up the vascular beds. We want to get things healing again, okay? Upregulation of antioxidant systems, and it has a wonderful modulating effect on the immune system. I mentioned this yesterday about the modulation. There's a lot of cytokines, interference, which is the language of the body. But unique thing about ozone, it modulates the immune system. What does that mean? What that really means is that if you're in a chronic inflammatory state, it re-regulates it, brings the inflammation down. If you have an immune system that is not functioning correctly, under-functioning, it upregulates the immune system. It's a very unique property to this type of therapy itself. Once again, it has the anti-inflammatory effect, but what we like also, it has what's called a high redox potential. And what's that? Well, this is based on life. This is based on the ability to transfer electrons. Because our life is based on what? The movement of electrons. So it has this high redox potential, and what it does is actually recharges the batteries in cells. It shares electrons through those actions it has, recharges those cells, and upregulates the healthy cells. So we kind of get that. We're going to repeat that again as we get into our story a little bit. But as we bring procaine in, now procaine was kind of an interesting, chemical that was really developed a number of years ago to substitute for cocaine. Okay, what could be bad about cocaine? Huh, Bill? Nothing. He poops good. Anyhow. Then we'll get off track. I'll pick on Griff in a couple of minutes. Anyhow, but the properties of procaine, so it was developed in Germany, it's a substitute for that. But procaine is a therapeutic, but it has anesthetic-like qualities because it stabilizes cell membranes. So it kind of reboots cell membranes. So it has this capacity to restore the equilibrium on the cell membranes themselves, increases neural tonicity. It has the capacity for retroaxonal transport mechanisms, of course nerves, and stabilizes nerves. It has a certain electrical charge that is exactly like the resting cell membrane. In addition, once again, it has effect on the cell membrane. It once again has that capacity, because it has a high redox potential, to recharge the batteries of the cell. Tenants work, talking about batteries. Well, this is the way you can recharge your cells also. But the beauty of it is you can use it as a numbing agent, okay, but it's therapeutic. But when it breaks down, it doesn't challenge your body at all. It breaks down to para-aminobenzoic acid, which is what vitamin B, and diethyl aminoethanol, which is a vasodilator. So we have nitric oxide formation, we have a vasodilator, we're getting vitamin B, we're stabilizing nerves and disinfecting and changing the ecology by just using these two simple elements together. Talk about the concept of bioregulatory medicine, and all of you should take a look at that concept, okay? Reckerwood's work in homotoxicology. And this is where we integrate another piece of the puzzle. Now, ozone procaine is a great piece, it does wonderful things, but you have to bring other pieces of the puzzle in. And this is where we talk about eliminating and helping the drainage effect in the human body, detoxification and elimination. And what we're talking about is really cleaning out the extracellular matrix. by using remedies from what's called HEAL. We love using HEAL remedies. You should check those out. There are a multiplicity of different ones. The beauty of it, if you step into the world of homeopathy, for example, we have lymphatic drainage, we have anti-inflammatory components, but the beauty of these type of remedies is they have multiple different type of homeopathics in there at multiple potencies. So the body picks and chooses what's appropriate for that. So we have the capacity for detoxification, and also these are supportive in the anti-inflammatory component. I know a number of you use this. So in our anti-homotoxicology therapy, we're trying to clean out the matrix, because we talked about the extracellular matrix. I'm not going to waste too much time on that today. But the matrix is the complete unifying theory in your body. Okay, it's a unifying biologic concept where if you take everything away from your human body except the extracellular matrix, you have a perfect outline of yourself. This is the highly controlled, highly regulated area that allows for nutrients, oxygen, everything to flow into the cells in an intelligent way, water to flow in an intelligent way, but also metabolic byproducts and information to flow out of the cells. Highly controlled. This is how it's regulated in the human body itself. So for detoxification and drainage, we use things like it's called lymphomyosat, Trameal, Zeal, and Lymphoden. The lymphomyosat and the Lymphoden are wonderful lymphatic drainage remedies. As you clean up infections, even after extraction, you take those nasty root canals out, or you clean up that mercury, you want drainage. You want the immune system to function right. These are remedies that you can easily fold into your practice to help that process so the body does not become congested and it removes the infection appropriately. Trameal and Zeal are anti-inflammatories, but well controlled. Your body picks and chooses the remedies that are in there. And of course, we bring in our Procaine. I'm going to show you a little formula that we use on a regular basis there. And we add a little magnesium, a little touch, a little kiss of magnesium to keep that vascular beds open and functioning. So our anti-homotoxicology formula that we're going to use on the cases I'm going to show, we really take, Procaine. We've always put a lymphatic remedy in there, okay, whether it's lymphomyosat or Lymphoden. We either fall in with Trameal, which is for more acute situations, Zeal for more chronic, and just a little touch of magnesium in these cocktails when we're dealing with these osteonecrosis or these more advanced infective states themselves. But as a biologic dentist, okay, an integrated biologic dentist, we transcend just the oral cavity. We transcend because we're looking at the patient really, the term holistic. Well, not, from dental school, I don't think anything exists from the jaw down, okay? We just have a body having to carry our head around, okay? But the reality is we are but one. We're but one being, and everything is connected to everything else. So we also look at the concept, what's important for your patients is hydration. One of the primary questions we always ask our patients, are you pooping every day? Am I at the dentist or what? Are you drinking water every day? I'll have a cup of coffee. Well, how much water are you drinking today? I have a cup of coffee. Right, Griff? No, I don't think so. So it's important to get hydration going, okay? Because that's always the universal solvent. Keeps your body nice and clean and functioning. Probiotics and enzyme therapy. Enzyme therapy is wonderful. You can use it to help digest food, but you can also use it as a natural anti-inflammatory because we're always fighting chronic inflammation. If you use enzymes properly between meals, you get an amazing natural anti-inflammatory to clean up all those soluble fibrin that runs around our circulatory system. But probiotics are so important because here we're nurturing our bacteria, our microbiome, our colonization within ourselves. We're constantly putting good probiotics. Another mantra, weed, feed, and seed the gut. Death starts in the bowel, of course. All right? But what's important, why do we care so much about the GI tract? The gut, because what lives there? Our immune system lives there. Remember, the gut itself is an external organ that we house inside. If you look embryologically back, you see where the tissue invaginates in, but this is how our perception of the world. You think your perception is my visualization, I can feel, I can hear, and all that. That's one level of consciousness. There's a deeper level of consciousness, how we're perceiving the world. Every time you swallow, that's over. Why do we swallow so much? Well, get the spit out of our mouth. Okay, that's cool. But the reality is we're perceiving the world. There's a consciousness here that they're perceiving the world. Is it antigen? Do we have to defend this or not? So there's a second brain down here. You might have heard about the old second brain down here. There's so much going on in your GI tract, it needs its own little brain to sort things out, to bring food in, to get food out, etc., but also perceiving the world. So we always love to nurture the GI tract. That's all part of the biologic concept itself. So once again, weed feed the gut, support that drainage, make sure you're pooping good so you look good every day. All right? And so regenerative therapy, what the hell is that all about? Well, it's very kind of simple in a way. You need the building blocks to repair yourself. It's amazing how, people get sick, they go into this chronicity state, and the nutrition falls off the cliff. You need solid nutrition from foundational, nutrient-dense diet, and things like essential fatty acids, phosphatidylcholine. These are the little subtle things they add into your diet, and minerals and trace minerals. Essential fatty acids, phosphatidylcholine, those are what? That's how you build cell membranes, phospholipids. You need good fats in, okay? Who loves hydrogenated oils here? I know you do. Okay. Remember, we need good oils. Coconut oil, okay, is a wonderful oil. What's another good oil? Olive oil. How can you forget olive oil? Because remember, your cell membranes are made out of what? Phospholipids. So your body's going to take what it can to make those cell membranes. Now, the beauty thing about cell membranes, first of all, that's where the intelligence of a cell is. That's cool. But also, there's a resonance to it. We resonate, okay? There's an energy to these cells. The membranes vibrate and move. Now, if you build it with good oils, you're going to get proper resonating. The cell membranes are going to function well. If you take hydrogenated oils in, those are very stiff and rigid oils, and you become a stiff and rigid cell membrane person. And that leads to all kinds of slow, chronic problems associated with that. Good oils are essential. Good oils are essential. And of course, as dentists, is everyone taking mercury? Well, how can you avoid taking mercury out? Who's taking mercury out? Yay! Hopefully you're taking it out very safely. But remember, one of the most important things for you to do is to protect yourself. The things we spoke about, all those protections. The patients come and go. We protect them as best we can. But you got to protect yourself. Why are dentists so insane out there? It's the mercury. Okay? That's part of it. All right? But what's important is that you take care of yourself nutritionally. One of the most important elements, I think, you should take every day when you get into the office, have some good trace minerals going. Okay, those trace minerals, our substitute will block out some of that mercury. Okay, because your body loves to pull materials out, pulls heavy metals, everything else out to use in itself. But if you don't present it with some quality minerals, it will substitute those primarily. But if there's toxic metals around, you're not supplying it with good trace minerals, it's going to suck those right in, and you become like a little mercury bag. That's always fun. So we're putting all these little pieces of the puzzle together, and I wish I had a lot more time to explain them, but more importantly, we're supporting the patient's own innate healing processes. Detoxification, allowing these pathways to flow so we get the toxins out. Because remember, once we take, let's say, the mercury out, we take infected root canals out, take all that stuff out, a lot of that stuff is everywhere. So the primary job is, we clean this all up. Mercury-free, hallelujah, never. It's all over the place. This stuff is all over the place. It has to be slowly mobilized and moved. So you have to make sure those pathways are open and supporting them in an ecological manner. That's the foundation for the concept of thinking. So with that in mind, what are the things we're dealing with today? Well, things have changed. We're dealing with environmental issues. We're dealing with all different type of particular problems that we've never had to deal with before. Where are all these crazy things coming from that we've never heard of before, or maybe we never publicized before? Well, some of the things we're dealing with is drug-induced osteonecrosis of the jaw, bisphosphonate poisoning, okay? Chronic infection. Why do these people become infected? What is infection anyhow? Remember, we're well colonized. It's when a group of psychos become more dominant, an opportunity comes by, they start to dominate, and if they're not healthy for us, that's called infection. Remember that 90% of us, it's when a population gets nuts, that's what we're starting to call infection. It's an environmental issue. Osteonecrosis of the jaw with poor extractions, root canals, periodontal disease, and rehabilitation of the head and neck. We're dealing with infestations today we never heard about before. Lyme disease, which are called Lyme syndrome. All those wonderful things, guess what? They're in and around your head and neck. And the wonderful, post-operative problems with some of the therapies that we have. So, thinking in biologic terms, this was Griff last night at the bar. Wasn't that you, Griff? Yeah. Okay. So when we think about treating the head and neck, and we look at treating these chronic issues in a comprehensive manner, we don't get focused on, there's the lesion, let's attack the lesion. Think more comprehensively about the issue itself. Comprehensive treatment of the head and neck, from the top to the base and beyond. We think about treating lymphatics, making sure the drainage is appropriate, the tonsils, the soft tissue associated with that. Utilizing the neurovascular pathways that deliver ozone and all the substructures. This is fundamental anatomy, okay? Fundamental anatomy. Using things we do every day, superior alveolar infusion, inferior alveolar infusion. These are pathways that deliver all these wonderful things to reduce down the infective state and change the ecology to a favorable environment itself. Treating the autonomics, which is the sphenopalatine, otic, and submandibular ganglia. If you have a patient that's chronically infected, okay, whatever that might be, those autonomics are not functioning correctly. They have to be re-regulated. It's very simple infusion techniques using Procaine. You can boot these autonomics. Why are autonomics so important? Well, it deals with blood flow. It deals with salivary flow, basic fundamental functions in the periphery of the, other than the cranium, the face, head, and neck, okay? Osteostructures, maxillomandible, and of course we're dealing with those what we call traditional dental infections, periodontal disease, chronic and infected root canals, which we love so much. And of course, utilization of ozone on all different types of levels can address these issues. But that, once again, is a piece of the puzzle. So, can our two primary nutrients support healing? Can we utilize water? Yeah. Can we utilize oxygen to help the healing process itself? So once again, let's touch back on the fundamental scientific facts about oxygen ozone, and then see how we can apply them to these chronic infective states. So once again, it has disinfective properties itself, which is wonderful, without any toxicity or side effects if used appropriately. As non-toxic wound cleaning, because if you can control the infection, the pathogenic forms in a wound site, accelerates healing. That is not impeding healing. And of course, we get the improved and accelerated wound healing itself. Activation of red blood cells. And the red blood cells start to activate, upregulate appropriately, but more importantly, ozone therapy allows for easy exchange between the oxygen and carbon dioxide. So you're getting what's called super-gifted erythrocytes that are functioning at a higher level. And of course, those antioxidant systems within cells. Ozone therapy is a therapeutic oxidative burst. What that does, the body recognizes oxidative challenge and starts to upregulate. The cells regulate up and start producing more antioxidants at the cell membrane level. And once again, what's really important, so think about it. We're getting red blood cells functioning better. We can disinfect things. I'm going to explain to you how that works in a minute. But also, we're re-regulating the immune system to start functioning in an intelligent manner. When it's not functioning right, when it's not getting the proper information and proper regulation, this is when we lose ground. Here, we can reverse that, but through the language. I spoke to this yesterday. The body speaks in cytokinase and cytokines. If that information is not correct and not in a balanced, intelligent manner, the body does weird things, like the epithelial cell. We love the epithelial cell. Dentistry is about the epithelial cell. But if not good information gets to those cells, they're going to function in a weird, different way. And then we call that, ultimately, dis-ease. So we get that increased antioxidant capacity through those activation of those antioxidant systems, things like catalase and superoxide dismutase. Those are the enzyme systems that quench oxidation therapy, oxidation challenges from ozone. And that anti-inflammatory effect, and once again, the increased production of nitric oxide. You need good flow. It's basic osteopathy. Good blood flow in, good blood flow out. We're getting production of nitric oxide, and that's allowing for all those vascular beds to open up, get the matrix functioning again, and allow for the healing process to occur. And once again, recharging those batteries, dumping electrons into the system. It's all basic biology. These are fundamental things that help and support the healing process itself. But the interesting thing is ozone is produced endogenously in the body. Our immune system kills the bugs by producing ozone. Okay, this was work that was done at Scripps Institute. Neutrophils, all these different things are producing ozone through this water catalytic pathway. Antibodies are producing ozone. So now, I have a natural remedy. Hey man, guess what? You really do. All we're doing is what the body does naturally and supporting that process. How can you get better than that? So white blood cells, plasma cells, antibodies, they all produce ozone. And it's interesting with neutrophils. I talked about this a bit yesterday. They did this one amazing study on neutrophils. Why does a neutrophil pack itself with vitamin C? What's it doing packing itself with vitamin C? It's self-preservation. When it engulfs the bacterial form, let's say, through pinocytosis, brings it in for years, it's got to be enzyme system, lysosomes, or fantastic. Dissolve it. Not true. What happens with this water catalytic pathway, it starts producing ozone, what punctures the bacteria, because bacteria, virus, fungus, and parasites have little to no what? Antioxidant systems in their cell membranes. That's why healthy cells do fine with ozone. Those pathogenic forms do not. So with the cell producing ozone, it releases vitamin C to quench the production of ozone within the cell membrane and self-preservation. How awesome is that? Biology is awesome. So once again, this is Scripps Institute done, ozone produced by antibodies. That was the first hint. Antibodies are thought to be what? Messengers. They tag things, release from plasma cells, the antibodies go in. They figure out what this thing is, start release interleukins out into the system for information. But they're attacking the bugs already by producing ozone, which is fantastic. Now, the properties of ozone, it kills bacteria, fungus, virus at much lower concentrations than chlorine. And we love using chlorine in root canals, right? But remember, you use chlorine in any form, there's always residual chlorine left behind in any system with that. And it kills it quicker. Well, how does that occur? Within seconds, ozone kills things 3,500 times faster. I always wondered who timed that, by the way. So, 500 million bacteria are here. They said count 1, 2, 3. Anyhow, so once again, these microorganisms that we're trying to recontrol, okay, they lack antioxidant systems in the cell membranes. That's why they're so susceptible to oxidative therapy, which is ozone itself. Now, another key element, which is very interesting about ozone and oxygen, it carries a certain electrical charge. That electrical charge is a negative electrical charge. Well, why would that be an advantage to us? Well, because remember, infection and inflammation has what? A very positive charge. It's very acidic. So the beauty about ozone is that it can track down and does the work. You don't have to overthink it. It will go right to these positively charged areas, neutralize it, and clean up that, and change the pH, and elevate the pH. That's why it works so well on arresting caries and dentition. Very positively charged, infected dentin, you oxidize it, reverse that process, and elevate the pH, which allows for remineralization. And that's one of the keys for osteonecrotic lesions, these cavitational sites. You do these protocols with ozone, and what you do, it's amazing with 3D cone beams, our marker is remineralization. No matter how much remineralization occurs, the point is that minerals cannot go back into bone unless the infection is totally gone, the inflammation is down and out. It's impossible. Because all those minerals that filter back in to the bone are all what? Positively charged. If you have a positively charged area, those minerals, you see them demineralized all the time because of the acidic nature of the area. Once we reverse that through oxidative therapies and some of the supportive therapies, we look for that remineralization effect. Once that occurs, wow, inflammation gone, infection gone, and we see the minerals start coming back into the matrix itself. That's the indicator versus going back. And I fixed your jaw. Can I have a hunk of it now, please? Yeah, no way. Okay? So we have this electrical charge, which works to our advantage. So what happens in vivo, okay, in us, is that when ozone is introduced into your system, it instantly goes into solution. The physics are vastly different from air. It instantly goes into solution. The physics allow for that. And what ozone is really a precursor. Once it hits the plasmatic fluid, it instantly converts into your peroxides, your custom-made peroxides. So the first reaction is what we call reactive oxygen species, which is the early phase. Those are the peroxides that go to weak old cells or the pathogenic forms that break them up at the cell membrane level. The secondary effect, which is very, very interesting, is what we call lipid oxidative products, LOPs. And those LOPs come from the cell membranes themselves. So the foundation influence of ozone, it's an autocatalytic biologic precursor, okay, and creates the primary and secondary reactions or messenger-like action at the deaning level. So what is happening is that we're getting the reactive oxygen species first. It's starting to kill all the bugs, but as it does break up the bugs and breaks up the cell membranes, those phospholipids from the cell membranes become peroxides themselves, lipid peroxides. Now those lipid peroxides perpetuate that because they're always trying to get more protons and electrons and all that, they're creating that cascade, that biologic cascade. But what's also very interesting, the research that's been done, it's amazing that those phospholipids, what they're called hydroxy peroxides, those are actually messengers that get into cells and signal the things that we're seeing symptomatically that are coming out of the cells themselves. So you have those peroxides, and this is where it's getting down to the cellular level, switching on DNA, switching on genes, where we're seeing that conversion where you have an easy oxygen release on the carbon dioxide. We're seeing at the cellular level, the immune cells, these phospholipids themselves are, regulating the immune system, and also cellular redox regulation is coming from these. So these are actually messengers now. These are becoming signals for the body to function, all the things we spoke about. We're knowing more and more and more from this therapy itself. So the initial effect, we have ozone in the plasmatic tissue. We have those reactive oxygen species. We're seeing that, once again, that erythrocytes have better oxygen delivery. The platelets are upregulating, creating autocoids and growth factors, okay? And also we see that immune activation. But secondarily, from those cell membranes being broken up, we're seeing where you have the lipid oxidative products. This is where the signals come. In the endothelium, we're getting nitric oxide formation. The vascular beds are opening up. We're getting upregulation of the antioxidant systems, those super gifted erythrocytes. But also, well, guess what? We're getting stem cells. Lots of stem cells come in. And not just field stem cells, absolutely scientific facts. They were seeing stem cell formation. This is why ozone works so well on joints and knees and ankles, etc., because you're getting really a release and regeneration of the tissue itself by production of stem cells. Awesome. But once again, we're getting normalization of the redox potential. When things are in balance, when you're chronically oxidated, this therapeutic oxidative burst re-regulates the system, and you start to function at a balanced level itself. But what's important, ozone is a really, really strong oxidant. I'm telling you, really strong oxidant. But, as Paracelsus said just a couple of years ago, wasn't it? The poison is in the dose. The sun can kill you, heat can kill you. It's all in the dose itself. So the language of ozone therapy, we like to use the term, micrograms. And think about it, we're using micrograms. If you have 1 cc of gas here, tiny little small percentage is ozone. The rest is oxygen. So it's really kind of an oxygen ozone therapy itself. And there's old terms like gamma, but we love to use more scientific stuff, micrograms per cc. So we used to be in the 80s, 90s, and all this type of world, but we found that kind of slowed the healing process down because now we're thinking biologically, helping the body heal itself. So for internal use, we use 6 to 30 micrograms. Any kind of infusions or injections there, we only inject gas, by the way. Okay, the physics are different. 6 to 30 micrograms per cc. External use for limb bagging, for wound control outside, 40 to 50 and 60 micrograms. And we only go up that high for root canals because we want to fumigate the hell out of those things. Okay? And also caries. We can arrest caries. And that gives a whole avenue in dentistry, a real different look. And always we start slow and go low. Okay? Easy, like good barbecue. Nothing wrong with that. Okay? So in an active infection state, like this bisphosphonate case, we'd start out in the 20 to 30 microgram, because what we have to do, first of all, is get this infection under control. Start changing the ecology, changing the environment, get blood flow going into this area, start changing things over, piece of the puzzle. As we see things, we're getting the infection under control, we slip into what's called the healing phase, where we drop our microdose down into the 6 to 20 microgram range. And that really keeps the blood flow going and supports that healing process, okay? So we're supporting the innate healing process. We're not overwhelming it, And there's the guy I speak with, Bob Harris, after he got out of prison, but I don't want to say nothing, right, Bob? Okay. So anyhow, in our integrated model, when I'm talking about ozone, procaine, and all that, these are all pieces of the puzzle, okay? And everyone has to be customized to their specific needs and how you treat them itself. So we bring all these different philosophies together in patient-focused care. And of course, we want to repair, restore, and renew. And when we do this, we look at nutrition, how the patient is functioning, and lymphatic drainage going. We do some deep infusions, which I'll show you in a second. We go nasal and ear insufflation, putting ozone, breathing ozone in a special way, and the ear insufflation, getting ozone to the system. Trying to get that gradient going, because as we clean up some of the infection things I'll show you, you want to make sure it drains out. It drains out, it doesn't become congested in the system and back everything up once again. So we put all those little pieces of the puzzle together. So when we have a complex case, whether it's a deep infection, osteonecrosis, bisphosphonate cases, we do our patient assessment, get a sense what their issues are. Beyond just the symptomology, what the hell is driving this? Or they've been poisoned? Are they regulating correctly? Are they draining? Are they doing all the fundamental biologic things? And then we bring them through what's called a preconditioning phase. We start to make sure the drainage is correct. We're not going into the focus of the infection yet. Okay, we're making sure all the peripheral tissue is up and regulating correctly, and I'll show you that. And then we get into the focal therapeutic phase, where we're going after the problem, or we perceive problem. Okay, the perceived problem, let's say an osteonecrotic lesion. And then, of course, once we get past that, we bring them through the healing aspect. We're bringing them through this whole healing process itself. So in the preconditioning phase, and this is really important on these osteonecrotic lesions, We used to do surgeries and stuff like that, but I haven't had to do a surgery on these lesions for, I can't even remember how long. But once again, you can get in there and change that. We precondition. Now, there's a number of guys who love to do the surgery. I says, please, do yourself a favor. When you look at these cavitation things, we think they're like these little balls or something sitting there. That is the furthest thing from the truth. In dentistry, we think in terms of 2 dimensions. We're in a 3-dimensional world now with the technology we have. Remember that these cavitational things, okay, maybe you have a focus of the infection, but there's wormholes going everywhere. In and around the teeth, through the jaw, up around, into the soft tissue. You may think you're solving a specific problem, but you're leaving a hell of a lot of stuff behind. That's why these surgeries repeat themselves many, many times. So if you think 3-dimensionally, how can we 3-dimensionally at least start to contain and withdraw these fingerlets out, these spider legs going out? And this is where ozone comes in so effectually. Number one, and I'll show you in a few minutes, if you at least precondition for a number of weeks and let the patient heal themselves slightly, if you have to do surgery, let it heal back. You'll pull all this peripheral infection back in, and there'll be a nice little thing sitting there. Go in there. If you got to scoop it out, go ahead. Okay? Preconditioning is such a critical concept with any kind of osseous lesion. Preconditioning, where we want to get things regulating right. When lymphatic drainage is going on, and we get that humeral homeostasis going, we're getting blood flow. Years ago, as a matter of fact, I was there with Mike Margolis, how many years ago in London, John was sponsoring it, and Bob Jones was there, the Cavitat guy. And it was funny with him because I was just introducing ozone. That's how long ago it was. And I think it was an IAOT meeting. Yeah, that was years ago. And I think it was Bob Jones developed this Cavitat thing, which is kind of like an ultrasound system for looking at these cavitations. And he says, "Damn, Phil." I said, "What, John?" "Damn ozone." I said, "What's wrong?" He says, "Oh, it screws up my readings." I says, "How does it screw up your reading?" "Well, you put the ozone there, those holes fill up with blood." That's the point. You know, you open up the vascular beds. It's like redeveloping a whole beautiful clot. You're opening up the floods. You're floating blood in there. That's the lattice for healing. Infection removal. Open up the vascular beds. Fill up the hole. Let nature take its course. Get the damn infection out. But support it with the other little remedies I spoke about. That's the point. Precondition those sites. You know, and that could be a few weeks. You know, when I have a patient come in that has these multiple cavitational sites, you know, we usually have, it could be 6 weeks, could be 7 weeks. The first couple of weeks, I don't even go into the cavitational sites. I do more deeper remedies, deeper infusions, which I'll show you in a second. So we're going in the periphery, making sure the lymphatics are draining right, the tonsils are not infected, their autonomics are regulating right. We're thinking in a bigger picture here. How can we rehabilitate the head and neck? And then we get into that focal phase, where we're going after the particular lesion. This is a bisphosphonate lesion. So this is where, you know, we're continuing cleaning and working the entire head and neck. But also, this is when we get into the lesion itself. You know, we get in there, we irrigate these wounds and stuff with ozonated water. We get in there and use our cocktails, okay? Surround the dragon, get up there and support that tissue, and then infuse ozone locally. And also in a deeper sense, okay? Once again, that ozone is going to open up those vascular beds. If you have a mandibular lesion, yeah, we're treating that. But also think about all those wonderful things we're producing. How do we deliver the goods to these wound sites? Think about the vascularity. Go back to your anatomy. Inferior alveolar block, superior alveolar. Get into those deep, drop some ozone back there. We'll get into those deep beds and open up the whole system. More ozone, the better, okay? And then we get into the healing phase, where we're seeing it start to resolve itself, the tissue's responding. In the bisphosphonate case, well, I'll show you where the bone is cleaving off, coming off. Don't yank on it. It will come off, okay? And let it heal itself. So, you know, the patients always said, "Well, doc, I mean, how much time is it going to take?" Well, with the cavitational issues, you know, normally about 6 treatments will do the trick. That's it. Then let them heal. Then we'll do another CAT scan down the road, and hopefully it looks fine, which most of the times it does, more than most of the times. When you get into these bisphosphonate issues and these deeper issues, it could take longer. It could take up to 12 weeks at times. And with bisphosphonates, they said, "Well, how long is that going to take?" It all depends on them. It all depends on them and how they respond to the therapies itself. So some of the armamentarium, you know, use a 10 cc syringe, 27 gauge needle, 18 gauge needle. You stab people that you like a lot with that. No, we only draw up solutions with that. And of course, we love the X-tip. The X-tip is the entryway into those holes in your jaw. So the X-tip, you know, is a beautiful thing about X-tip years ago. You know, it's for, you know, it was used for anesthesia. You have a tough tooth, you know, drill this hole in there, you can squirt the anesthesia in there. I said, wait a minute, wow, if I can pump anesthesia in there, boy, ozone gas will certainly flow in. So we've used that ever since, which is awesome. So you can see here cases like this, where you have a little mercury left behind. That's always a treat here. These cavitational sites, you drop that X-tip in there and clean up those problems itself. And this is how you would place the X-tip. The X-tip is great on any edentulous area. That's where you place your X-tip. Never place it on the palate or on the lingual side of your jaw. The patient will look like this and snap it off. Then you have to go fishing for the Treffen tool. Don't do that. And here we're infusing our preconditioning, our cocktail itself. Here we put actually some B12 and folic acid in there. We used to make that standard part of our cocktail, but with these MTRF issues these days, we're very cautious on where we put vitamin B and folic acid in. So we kind of pull that back until we know, you know, I don't know where the hell that's coming from now. It's everybody and their brother seems to have that methylating issue these days. I think we're being poisoned. But so we always back that off a little bit now until we really see if the patient has that particular issue itself. So the beauty of this, and when you drop an X-tip in there, you start to infuse the ozone, you wait a couple of minutes, and the wonderful thing is that you start to see the red blood, the blood coming up out of the port. So always do that when we teach this in our advanced course, but you'll see this bleeding up here. That's what you want to see, because guess what? The blood flowed back in. The lattice for healing. The lattice for healing. Once again, we love those edentulous areas. And here's a little example. We had the cannula, the X-tip itself, and a little butterfly we put through fell right into the cavitational hole. Perfect. Put your cocktail if you want, or get the ozone in there to remediate the issue itself. And lesions like this, these are bisphosphonate cases that we've seen more and more and more. And you have to be very patient with this. This is where ozone plays such a critical role, because when these things have this osteonecrosis, the vascular beds are collapsing down. They're poisoned, okay? So this is where we surround these issues themselves, and carefully with these bisphosphonate cases, don't go in there, you have a principle, I want to yank that bone out of there. Don't do it, okay? If you can take an Explorer and flick it out of there, that's the perfect time to do that. Okay, there's some kind of a whole process that we spend quite a bit of time discussing more detail. Once again, we can locally deliver the ozone to all these particular areas, problematic root canals, and of course cavitational sites itself. This is one of the most potent infusions there is. We call it the pterygoid plexus infusion. Basically, it's kind of like a deeper superior alveolar infusion. This is one of our primary infusions, where we take our cocktails, our homeopathics, our procaine, place it deep up behind the maxilla itself, wait, and we follow that ozone. This will comprehensively envelop the entire head and neck, and really the rest of the body, even though nothing exists from here below. It will be a comprehensive infusion. We can be picked up by all the vascular beds. So this is one of our foundational influences that we can clean up the entire head and neck. So we do this for a few weeks fundamentally. You can do that externally or internally, and really deliver the goods that way. But also we have a technique on low microdosing following the lymphatic chains. With a little ozone subdermally down the lymphatic chains, that dramatically allows for drainage, because it's important. Once you go to the nuclear bombs right here in these jaws, you want to make sure you're draining, because as you clean it up, the body wants to flood in, and it's got to get all the stuff out. And this little ozone and technique, here you see we're doing the pterygoid infusion area, lymphatics are critical to treat. So when you have these multiple chronic infectious disease syndrome, which is kind of like the new name for Lyme disease, because nobody knows what the hell Lyme disease is anymore. Okay, you have these lesions that are developing in this patient. This patient had an extraction 7 years ago. Why the hell didn't it heal? What's going on with her? Because of the infections associated with that. So we're able to get, the tooth is extracted, and prior to treatment on the, I guess, your left side to my right side, maybe I got a laser, what actually works. So treating ozone directly and indirectly, we supported that healing process and had regeneration of the bone itself. You can see the difference. This is why we love 3D cone beams, because you can actually three-dimensionally visualize this. And we also got rid of a nasty little root canal, got that healed up. But you can see the difference in the jaw lesion itself. This is bisphosphonate problems. These are the worst. These are I thought the cavitational issue was going to be complex. This is problematic, because you're dealing with most people that already are compromised. The doors are opening now. In New Jersey, we'd already broken their legs. Forget about it over there. Hold on, brother. Don't mess with me now. I'm finished. This is my crescendo. I tell you, it's a rough crowd. All right, I'm hurrying. Damn it. Anyhow, so these are the type of lesions we're dealing with. Here's a case we worked on for a bit of time. We had, we can see the damage. This is all what we call dysregulated tissue. Here we did irrigation. We did direct insufflation, deep infusions on these cases like this. We're able to get it from this type of tissue. Up here, we're actually looking at the ceiling of his sinus. The damage was so deep on that case. Here's a case I worked with Lou Travato. This is Lou Travato memorial slides we're going into now. Hi, wave hi, Lou. Okay. This is dysplastic tissue. Now, this girl had multiple surgeries to remove this tissue. Couldn't do it. So Lou and I worked on this case, and Lou did a great job, did infusions here, and to this day, this tissue has never come back. Ozone is fantastic on basal cell carcinomas, etc. Fantastic. Once again, it was, about 7 weeks or so we treated? Yeah. And that healed up beautifully. Another case that Lou finds these cases, and we ship them back and forth, where this lady was heavily infected, had a wisdom tooth that was literally floating underneath there, and the physician, the oral surgeon, well, we can't get in there. So started treatment on her. You can see the change in the tissue itself and that visualization. It's amazing how far people let themselves go. And here's a case where it's squamous cell carcinoma. Case here where we started just treating the infection. We don't treat the cancer. This was a guy who was a very famous voice coach, Manhattan, everything else. And he went to Sloan. They said, well, we're going to take your jaw away. We're going to cut your tongue out. And the guy literally passed out in the office right there. So, and the only thing this guy had, he always had his cell phone in his face, constant on that one side. And I'm telling you, I see more and more of this crazy stuff. So we started working on ozone, and we were able to get him reduce that infective state down to that small lesion where he can manage it a lot better. Contract it back down. And this is one of my favorite cases I worked with Lou. And this guy's doing fine today. He had cancer, and he had basically his maxilla on his left side totally removed. Now that was one thing. But the tissue damage from the radiation therapy did a tremendous amount of damage to him. And what did the physicians say, Lou? What can they do? That's it. You live with that. Well, he doesn't have to live with that. What we did, we were able to infuse that area. Lou did the yeoman's work on all these cases here. But you can see the attributes of the ozone, the Procaine, the different remedies, where we're reestablishing vascular flow, allowing the patient to heal himself and get that tissue integrity back and functioning itself. And you can see the difference between that and on the right side itself. Supporting the patient's own innate healing process itself. And this is, I think, Lou and I's favorite slide, where they did a graft on the guy and put it inside his mouth. So he has a little tiny razor he shaves periodically inside. So, wow, with the last panel, we're almost done. Whew, I tell you. Well, I got a few things to say, but I won't. So unfortunately, I had to speed through this, and interesting enough, treat the entire patient. Don't get hung up on the foci of the infection. Don't fake yourself out on that. Appreciate the patient's poor, unfortunate experience. Integrate your treatments and always be open to modifications. When things don't work, modify it, change it slightly. And try to understand when you start thinking biologically, you think differently, okay? You start to try to appreciate the deep underpinnings. What the hell's driving this thing? Don't forget the autonomics, very, very simple infusion techniques, and have patience. These are biologic therapies. They take time to convert over. It takes time to heal. And there's my beautiful daughter in India, admiring herself as usual at Georgia. Thank you very much. Thank you.